So some of the common symptoms people complain of, obviously heartburn is probably on the top of the list. Then there can be issues with chest pain. Some people experience chronic problems with dysphagia, or what we call difficulty swallowing. Some people can note issues with nausea or even vomiting from really bad reflux symptoms. Then you can get into some of the atypical things, which are things like unexplained cough, a chronic cough. Some people will have problems with hoarseness or change in their voice. You can get into things more obscure, chronic bronchitis, pneumonia for patients that really have no other explanation. So those are probably some of the most common symptoms you'll see. Some of the common triggers for folks with reflux. Unfortunately, they are many of the things that we enjoy eating. So I always ask patients, do you have issues with any particular foods? And the most common things are spicy foods, red sauces or tomato-based foods, so spaghetti can be a nightmare for some patients. Coffee, which is a staple of many people's daily routine, can be problematic. Caffeinated beverages can be a problem. Chocolate, peppermint, those are probably the most common food products across the board. The other thing that can worsen people's reflux is weight. And so I always encourage patients that may be a little overweight, trying to lose weight, especially if they're interested in medications and not surgery, that even losing sometimes 15 pounds, 20 pounds can improve their symptoms along with the medications. Biggest risk factor for Gerd is obviously uncontrolled reflux leads to inflammation, which then leads to pain. So you get inflammation or esophagitis, and that can be seen by doing an endoscopy. Next thing you worry about is uncontrolled reflux can lead to strictures, so a narrowing somewhere in the esophagus from uncontrolled acid coming up and affecting their esophagus. Then the real thing we're really targeting here is Barrett's esophagus. Folks who have uncontrolled reflux for a long period of time can develop Barrett's, which is considered a precancerous lesion and can become esophageal cancer if it's not caught early or controlled. And then obviously the worst case scenario is esophageal cancer that can occur as a final result of just poor reflux management. It's only harmful if it's a chronic problem. And again, we all experience a little reflux, but it's the folks who eat those things that they shouldn't, experience burning and don't take any medications, and it becomes a chronic thing for years and years. Again, orange juice, lemonade, like you said, salad dressings, those things too have that acid component that can be very problematic. So to have a patient come back and see me after a week and go, I had orange juice for the first time and it didn't burn, that at least tells me that I was successful in what I set out to do for them.